So, Dr. Albert, apart from COVID-19 patients, there are other patients that come to this hospital and need surgery. You've been telling me about the alternative arrangements at the hospital here. Could you explain more to me how those patients are cared for?
Sure. What we've done here at GPHC is we've created a separate operating theater for patients that might be suspicious or confirmed with a COVID virus, because the hospital does not deny care to anyone. So a positive or suspicious COVID patient will not be denied emergency attention. Henceforth, a separate operating room was set up, and we have gears in place, and the doctors there are trained on how to get dressed, etc., their protective gears, and other persons from my department will be available to provide anesthesia and ventilatory support during this period.
So the hospital has not stopped general service because of COVID-19?
We have not stopped. We cannot stop emergency services as well, because though COVID is going around, it's on the rise, we still have patients that are coming with acute things happening. So yes, we do continue to provide emergency care for those patients.
I didn't ask you about the COVID-19 unit itself. It caters for 16 persons, is that correct?
It caters for 16 persons. We have beds and ventilators available. So the ventilators are there on standby if the patient needs to be intubated. Like I would have mentioned, we try our best to make sure that they don't need intubation, but unfortunately some patients do reach that point, and we try to have it done in a timely fashion so that we can do as much recruitment, as much along recruitment mechanisms as possible in trying our best to save these patients.
Doctor, obviously this is a new area of work, COVID-19, and it calls for a little bit more extra on the part of you doctors. Explain to me what it takes out of you personally to be able to function in that unit.
So personally, we've all had to make sacrifices in relation to our families, etc. Some doctors are staying out of their homes, doctors and nurses, to avoid any possible transmission to their family. I personally have opted to send my family away. I am a young mother and wife, and my family is in another district. I won't be able to see them or so until this COVID situation would have ended. So we've all been making sacrifices in relation to our personal lives and our families, but fortunately we've been supported by our families, and so we're able to continue to do our duty, which is to help persons as much as possible.
Tell me what that support is like from them, from family and friends.
Yes, I personally have been getting tremendous support because sending my family away, it wasn't a fight. They willingly went away because they understand my role, and they keep checking up on me. Some persons, sometimes just a phone call is good enough, and you know, it keeps us going, remind us what we're here for and what our duty is. So those little things go a far way. We've also had support from other members of the public, businesses, etc. And we're grateful for that, and it keeps us going, you know, these little things. So we are sacrificing a lot, but for the greater good.
Mentally, how is it for you?
So mentally, it's a bit stressful, but hearing and seeing recovery helps us. It gives us that bit of satisfaction. And then knowing that persons out there are willing to follow guidelines put in place also gives us a bit of relief, because it means that we have persons helping us in working towards flattening this curve. So that is somewhat some relief. But we've also been offered assistance from the psychology department if we need to talk, etc. Doctors and nurses will be able to be in contact with those persons who can assist us in whatever way.
Thank you very much.
Thank you so much for having me.